Well, as a health scientist, I would like to continue seeing good social behavioral research. We are doing so much good work in the biomedical area. And I don't want to see us forgetting about the social aspects of the epidemic. You know, the fact that we're talking about pre-exposure prophylaxis or using biomedical resources for prevention, that's fantastic. It is great that we have more tools for HIV prevention, but we should also work on the conditions that put people at risk. So what can we do so people can actually have access to whichever mean of prevention they want? And that requires research. And I think that while we continue moving science to a place where we are providing more resources, the truth is that we need to also study the conditions that are affecting that not everybody really have the same access to all these new mechanisms or approaches to prevention and care. So, well, something that is very amazing about USCA is the ability that the conference, or the opportunity, I should say, that the conference provides for networking. I always learn from the leaders, the people that are doing the day-to-day work. And to me, something that is very important is to leave the conference inspired by the work of others, encouraged to do my job better, and hopefully, this is also an opportunity, as we will do tomorrow in our plenary, to showcase the case of Puerto Rico and to encourage my fellows in the HIV field to be to have a better understanding of what's going on in Puerto Rico as a case of where the context actually might explain better the epidemic than actually the behaviors of the individuals. So if that happens, I'll be very happy. Sure. So tomorrow we're talking about the HIV epidemic in Puerto Rico in the times of economic crisis. I'll be presenting with 4 more Puerto Ricans that have different experiences working with HIV and Puerto Rico. And the expectation is to, first of all, share what is the current status of the HIV epidemic in Puerto Rico, and that's my part. I'll be presenting the social epidemiology of HIV/AIDS in Puerto Rico. We will discuss that from an economic and political perspective, and then we will have the voices of people doing the work in the government and at the community level. So how the responses from those 2 stages are being articulated under crisis created mostly by our political status within the United States. Okay. So tomorrow the talk is about colonialism and HIV.